Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach about soft tissue injury and mechanism of injury and the approach to a patient with soft tissue injury. So how the patient approach of soft tissue injury patient and what are the goals and treatment we need to suggest them. Okay. Now firstly, soft tissue injury. From this name only, soft tissue injury, it is not soft but hard in terms of treatment and rehabilitation management, treating patients. It's not soft in treatment, but what is soft tissue injuries implies means, what does it means skin, that subcutaneous tissue, fascia, muscles, ligaments, tendon, synovium, capsules, nerves, etc. These all comes under, except bone, these all comes under the soft tissue injury. By injury of this comes under the soft tissue injury. They are more common than bone injury. So these are more common than bone injury. Sports person are more prone to it. Okay, sports people are more prone to it. Firstly, in soft tissue injury, we need to give firstly conservative treatment. Next, physiotherapy treatment it plays a mainstay of treatment, main role in treating the soft tissue injury. Now, what is the mechanism? See, mechanism of injury. They are direct trauma, direct injury, and indirect injury. Direct by fall or RTA, means road traffic accidents, assaults, etc. Contusions, hematomas, lacerations, etc. These are directly by hitting. Okay, like that we can say. Indirect means by not trauma, means by not injury, avulsion injury, muscle pull, ligament sprain, etc. These are all indirect. These are common in sports person. Why? Because there will be all pulling, pushing like in sports person. No? So these are indirect trauma without accidents. Okay. Now approach to a patient with soft tissue injury. Now patients, firstly they'll approach to the physiotherapist or the medical therapist. Firstly we need to listen the patient's story. Firstly listen the complaints, what patients say. They'll drag the story. Don't listen all the points. Make sure and take a pinch of salt like information, like main information, what the main cause of the injury. Okay. Now next, your observation. They are saying correct or not, you need to observe by doing assessment of that injury in regret to that where did that injury happen, that site, nature, and intensity, how much the pain we need to test. Next, goal setting. By that injury we need to set the goal, like immediate or long treatment. Okay. Next, execution of your plan. By knowing the injury we need to execute the plan. Now what to give the treatment, like that, by careful evaluation of injury, keeping both short and long term goals in, okay, in mind. Okay. Now we need to keep this all in mind and we need to give the treatment. Now goals and treatments. Now when the patient come, immediately we need to give first immediate goals. With blood, with injury they'll come. Now immediate goals, we need to control. If there is any blood loss, we need to control blood loss. If there is any swelling, minimize it by applying ice layer. If pain, we need to alleviate. If joint stiffness, we need to prevent it. Muscle weakness, we need to maintain the power by increasing the muscle power. Now distant goal means long term goal means, so the efforts are to be kept to the derelate life of the soft tissue back to and restore the structure of the pre-injury state. Okay. So distant goals means we need, after immediate goals we need to think of the distant goals, means next approach, like next treatment, like movement. To improve the movement restoration, they will need to check whether there is movement restoration, mobility. We need to check the mobility and we need to ensure affected part. and strength, we need to strength and endurance of that part. Best endurance means accurate of the strength, okay, to the best. And proprioceptive and kinesthetic mechanism, we need to restore it. And daily and functional activities, we need to restore it back to the original. Next, confidence, we need to build up the boost the patient's moral and also that of the affected part, okay. Now next, we need to follow up the treatment and home advice also, we need to suggest them, okay. These are all the soft tissue. What are the soft tissue injuries? These are soft tissue injuries, and mainly in sports person, and mechanism how soft tissue injury happens. Next, approach to patient with soft tissue injury. Approach means when patients come, what we need to see, and we need to execute the plan. Next, goals and treatment, we immediately we need to if there is this problem, we need to control, and if the next, after immediate treatment, we need to give the distant goals, means we need to see further treatment, okay. Thank you for watching this video.